Good afternoon. This is the House Appropriations Committee. It is April 22nd, 2025, just after 2 p.m. And we are here to continue our conversation about federal funds. This is about substance misuse, and we have Paul Daly, who's the Finance Director for the Vermont Department of Health, with us to talk with us. So welcome. Thank you very much for coming.
Thank you.
And we appreciate your time. So we had a committee, there's something on our committee page about this. So Matt, you want to introduce yourself, Paul, and take it away, please.
Thank you. My name is Paul Daly. I'm the Financial Director for the Health Department. And I've been invited to testify to the committee on federal funds used for substance misuse. And provided a summary to the committee that's been posted on the committee's webpage. And I'll refer to that in my testimony. Our substance use programs appropriation is section B 313 of the budget bill. And that's where our substance misuse prevention or substance misuse funding is contained. And so that's the appropriation I'll review for you today. As you can see from the material I provided, the overall appropriation that's recommended in your version of the budget as passed is 69 million and change. And of that, just under 16 million is expected to come from earned federal receipts. And there's 5 sources of these expected federal receipts. And I've described each of them in the summary I've provided. The largest of the 5 is the Substance Abuse Block Grant, which has recently been named the Substance Use Prevention, Treatment, and Recovery Services Block Grant. So it now is referred to as SUBG. This grant comes from all of the federal funds I'll be talking about come from the Health and Human Services Department. The SUBG comes from the Substance Abuse and Mental Health Services Administration. It is one of our oldest grants, was originally authorized in 1992, and it's a non-competitive formula grant. So the amount is authorized by Congress, and there's a published formula for what each state gets. Each year we get an award, and we have 24 months to spend that award. So the state has some flexibility. And the current award period for that grant ends the end of September 2026.
So you don't need to apply, you just.
That's correct.
Get it. Okay, so.
We need to submit a budget and a work plan.
Oh, you do?
But
Okay.
they're not competitive.
Right. And so when do you typically, so if this runs out in September, a year from now, 15, 16 months, when do you have to start putting together
We will get a new award on or about July 1st for the grant that is funded in this federal fiscal year's budget and will extend until September 29th, 2027.
Okay.
So that they actually have overlapping performance.
Right. So you hope you'll hear something from the federal government this summer, basically.
Right.
Okay, thank you.
The next one is the State Opioid Response Grant. Again, the funder is HHS SAMHSA. This grant is available, again, as a non-competitive formula grant awarded to all states, first authorized in 2018 as a response to the opioid use crisis. And it provides a broad range of allowable uses from prevention, the entire continuum of substance use prevention through treatment. This award has a 5-year project period, which runs through September 29th, 2027. We receive annual grant awards. With the exception of Medicaid administration, which I'll address, each of the grants I'm referring to, the appropriations that will fund the grants that we'll be earning in state fiscal year 26 are included in the current federal budget, the one that's run under the continuing resolution. That's one of the reasons why you'll often see grant awards of September 29th, because they're actually awarding the funds on the last day of the fiscal year.
Okay, so you get this, it's a 5-year grant, but you get to draw down once a year?
You'll get an award each year. And
okay.
Usually, in most cases, and it's clearly the case in these, funds that are unexpended at the end of one budget year remain available through the end of project period.
And they remain available, they're being housed in the federal government, or do you draw them down and you can use them over the course?
In general, Madam Chair, the agency follows a federal requirement that says you have to minimize the amount of time between when funds leave the federal treasury and when they're put to use.
Okay.
In practice, what that means is we draw down funds weekly, monthly, or quarterly based on the expenditures that the state has already incurred. So for the most part, we're drawing down after we've spent the money.
Okay.
The next one, we're budgeting just over 1.5 million in a grant titled Overdose to Action in States. This grant is from the Centers for Disease Control and Prevention. It was initially authorized in 2019 with a current project period running through August of 28. This focuses on surveillance and prevention grants, prevention efforts. And it's one of the first large-scale CDC grants that was really trying to understand what was going on with the opioid use crisis. So there's always been the SAMHSA's focus, while they try to understand the broader picture in the population, they're often focused on treatment simply because that's where the need is greatest. So these two, state opioid response and OD2A, are relatively recent, and they're a significant part of our ability to fund our funding portfolio for substance use prevention, treatment, recovery. And we do, while we have a broader portfolio in this appropriation than we have in some others, these federal grants amount to just under a quarter of our overall budget. We have, when you take into account the global commitment funding and the special fund funding, in the 26 budget, you've got a significant new infusion of funding from the Substance Misuse Prevention Fund that provides for a more balanced portfolio than usual. And in addition, it's not included in our base budget, but the one-time appropriations that have been made from the Opioid Abatement Special Fund are also part of that portfolio. The next one is slightly different than the other grants, about just under 1.5 million for Medicaid administrative claiming. This is from the Centers for Medicaid and Medicare. The Medicaid program authorizes states to claim reimbursement for expenditures necessary for administering their Medicaid program. And we claim in this appropriation administrative costs for the people who oversee the credentialing and monitoring of our substance use treatment providers. The federal participation rate is 50%. And it shows as federal funding in our budget because Medicaid administration is not included in the global commitment waiver. So the appropriation comes as federal rather than GC. That's an annual grant award, but it's hard to think of it as an annual program. This is an acknowledgement in the state-federal partnership for Medicaid that this is what it takes to run the program. And the last one is again from SAMHSA. It's the Strategic Prevention Framework Partnership for Success for States.
Okay.
The health department calls it PFS3 because it's the third iteration we've had of an award. It's a SAMHSA grant that's focused exclusively on prevention. And it is part of the portfolio for the substance misuse prevention, primarily focusing on community prevention. This is a competitive grant program with a new project period starting in September. We have submitted our application for the new project period. And in most years, we won't expect to see a final announcement until then. While it is a competitive grant, the funding agency awards these grants in tranches. So more than half of the states have them, and we're on staggered schedule. So there'll be, I believe, 6 maximum awardees, but that doesn't mean our chances are 6 in 50. And this would be the third consecutive program period, project period that we've had if we receive that award.
Paul, let me ask you, are your contacts in the federal government all still there at SAMHSA, at CMS, at, the people that you normally work with, are they still employed? In my office we've had trouble in this with folks where offices have essentially been laid off in CDC. Mm-hmm.
Can't say with confidence that that has occurred to the same extent in SAMHSA.
Because I've heard that SAMHSA had some cuts or layoffs or something. I seem to.
Can't speak to that, Madam Chair.
You haven't heard, Jen?
Can you enlighten us at all as to what you're hearing? I thought I saw something in the news recently about vaccine promotion that may have been used, and I don't know if that was actual. Did we get federal help for administering vaccines, or was that only during the pandemic?
Thank you, Representative Harrison. Though I came prepared to talk about substance misuse. So one time
Department felt that would be sort of a separate.
I'm happy to try that because it's an area I'm familiar with.
Okay.
And, the federal, obviously, HHS and immunizations have been on our mind in public health for last month. The Health and Human Services provides significant assistance to states for immunizations. The HHS provides direct funding, direct assistance to states for what's called the Vaccine for Children program, where children on Medicaid, the federal government provides vaccine to states at no charge. So you don't see it in our budget because it comes as basically an in-kind contribution.
These be like measles.
All the recommended childhood vaccines. Yeah. All those recommended by the Committee on Immunization, which has not met since the new administration started, the advisory committee.
Any change in that statement?
We've seen no evidence, nothing official or even implied about the Vaccine for Children program. The state receives an immunization grant that to operate our overall program, including an immunization registry. That project period ends at the end of June. We've submitted an application for a new round of funding that would start in July. You may have read that there was one grant that was recently, it was canceled sooner than expected. And it was an immunization supplement award that was initially awarded during about the second year of the COVID pandemic and had been extended successively. That award was slated to end at the end of May of this year, 2025. Prior to the change in administration, we had been told to expect what's called a no-cost extension, where they wouldn't give us a new award, but we would have more time to spend the remaining balance. This administration chose to cancel that award among several other COVID-era awards effective March 24th.
Was that for the actual vaccine, or was that for a function of the availability of the vaccine?
When it came initially, it was still at a time when the federal government was funding all of the COVID vaccine costs. So the primary intent initially was to do outreach to encourage folks and help facilitate the distribution of the vaccine. In more recent years, states could use it to purchase vaccine. But that usually wasn't the main thing, because you had a situation where for most of the past 2 years, Medicaid has been funding COVID vaccines at 100% federal participation rate. And in Vermont, the state's vaccine purchasing program recommended COVID and was purchasing it and distributing it to providers at no charge to the providers. So the funds in that award were primarily used for work to increase or maintain immunization rates, particularly among children, which there was a fair amount of catch up to do after the pandemic because it was many young children got off schedule because of having challenges getting into doctors' offices. And so that's where a lot of the work's been going. So we will be submitting our final claim for federal funds in that grant this week.
Thank you. I didn't need to take you off track.
I feel more confident when I know I'm prepared. And so
We all do, I guess.
It's not me.
Financial director. So, any other questions for Paul on this?
Well,
Yeah, go ahead.
I mean, I guess what I'm taking from your presentation is that, well, let me ask the question. Are you concerned about renewal of any of these grant programs?
were these five, Representative Bloomley, I'm not concerned primarily because these have been appropriated. All the funds that will be in these grants that we will draw down have been appropriated by Congress. And while there has been some question about compliance with the Impoundment Act, we have across our portfolio of federal awards, and we have about 130 active federal grants at any one time. It's not anywhere close to normal, but we are seeing grant awards on closer to a normal schedule. The early attempts where we were told these are frozen, we're not hearing that anymore. So I expect that the funds that are in the budget, we would see those. There's not an ideological basis for this administration to want to try to change these, whereas you could this committee, some of the members probably were familiar with in the first Trump administration, there was the rule change that really made the state unable or unwilling to participate in the Title X family planning program, and the state had to fund that for 2 years. So we know those things are happening, but these grants aren't in the crosshairs.
And who are the beneficiaries of these grants?
In each case, about between 70 and 90% of the funds go out as grants. The substance use prevention block grant is about 30% personal services, but the others are much lower. The overdose data to action has more staff in it because a lot of the surveillance work is done by our own staff, this surveillance and analysis. So that's the one that's about 50-50.
But who actually are the beneficiaries of this? Who are the Vermonters that benefit from having these programs?
And each of these, all but the PFS are available to fund the entire continuum of substance use services. And it starts with prevention, whether it's in school age populations, in community-based prevention. It continues through support for outpatient services provided by our community providers, often providing support for their clients who are completely uninsured. These provide that gap filling, provides workforce development in some cases for some of those providers. In residential treatment setting, it often funds those things that would not be eligible under Medicaid. And it provides, it's a substantial part. It's not the largest part, but it's a significant part of the funding for recovery services.
Excellent.
Yeah, we just talked about to expand high intensity and low intensity treatment for people with mental health and substance abuse.
Mm-hmm.
What is we've had these for a while.
That's correct.
What is the efficacy of this? And when you talk about who are the beneficiaries, are we seeing less of it? Are we seeing an improvement in the people who have been suffering this substance abuse? I mean, what are we getting for the dollar? What's the bottom line for the dollar?
Representative Dickinson, that's outside my area of expertise. I can offer, I know from having heard the subject matter experts talk, and one of the things that's often brought up is particularly the substance use treatment, prevention treatment block grant is one of the few places where we can focus on alcohol use disorder. The more recent funding has been focused on opioid use disorder, and alcohol use disorder is a much bigger problem in Vermont. With respect to how well they work, because we've been doing prevention work in some cases for 2 decades or longer, we have been able to accumulate significant evidence that evidence-based practices in communities will make a difference in the rate at which and the age at which youth take up the use of tobacco, alcohol, and other products. And that's that was an important precondition for certainly for Dr. Levine's willingness to not necessarily support, but his objections to legalized cannabis were addressed in a key way by the commitment of 30% of excise tax revenue from cannabis to be used specifically to educate young people about the risks of cannabis to developing brains. So that wasn't coming out of a vacuum. Dr. Levine was confident from the evidence we have in Vermont that communities that have been able to apply evidence-based practices over time reduce substance use, particularly among young people. And that usually, particularly for illicit substances, will continue well into adulthood.
What about things like vaping? I mean, tobacco seemed to go through it was prevalent, then there was a decline, and now it's be going back up, and now we're getting vaping. Is that part of this? You address a good point, Representative Dixon, because the appropriations our review in our office, that it's in the public health appropriation that we do most of our tobacco control program work. And while vaping is one method of use of cannabis, particularly among young people, it's been primarily for use of nicotine. And I can tell you that the vaping use among school-age children has declined significantly from its peak. I think the science has not been able to determine the reasons for that, but that it is clearly in decline. It's not what I hear on the street, but that's nice to know.
Again, this probably for Vermont specific data, the most reliable source is the Youth Risk Behavior Survey, which has been consistently validated for decades, and that's what we use to track that particular use. Yeah.
Any other questions for Paul?
Thank you very much for coming in. We appreciate it.
I hope it's helpful to you folks.
It's very helpful. All of it's helpful. Every little piece of the budget. So.
Thank you, Paul. Good to see you.
Committee. That is it for today. Tomorrow morning, we start at 9. The regional planning commissions are coming in to talk about their life and their world. And then at 10:30, Department of Economic Development and the Department of Tourism. Everybody's asked about the Department of Tourism. They're coming in tomorrow at 10:30. And then we'll have A&R in the afternoon after the 4th. So that's where we are for now. We don't have any bills yet, but we'll probably be getting more bills. So I'll let you know as I hear, but I sent you a list.
Human Services wants me at 10 o'clock.
At 10 o'clock?
They haven't asked me yet, but it's on their agenda. I'm ready.
Great. Well, it sounds like hopefully they won't need you for more than half an hour and you can be back in time for tourism.